Everyone, so I just wanted to do a short video, just a little bit of a rant that I just need to get off my chest, that I wanted to talk about. So stick around and listen up. So I've mentioned this in some other videos, but I want to make sure it's clear because this is such a big deal. Okay, if you're going to be a doctor, whenever you get to the hospital, no matter what practice it is, it needs to be one you love, but whatever practice it is, when you get to that hospital, each and every patient you see has now become your responsibility, your patient, your family, and you need to treat them as such. Every single patient you encounter, that needs to become someone of your family, that now you think of them as your brother or sister, that you think of them as your mom and dad or your grandma and grandpa. Because if not, they're not going to get the care they deserve. I'm going to get worked up a little bit, working up a sweat, but I want you guys to know, like, why I'm talking about this is, I've been in the hospital for a few months now. I've loved it. I've loved every second of it. But there's been some things I didn't like. Most of it being where I thought the patient was neglected or the patient didn't receive the care they need. Where maybe they're smelling and they need a good shower, but it's not getting done. They need a good bath and we're not willing to do it. Or maybe they needed someone's shoulder to cry on, but yet we're too busy to go do rounds or to go do something else. See, that cannot happen. When we walk into their room, that patient, they are our responsibility and we need to take charge. Even as a student, if we don't think this patient is getting the care they deserve, we need to talk to the nurses. We need to talk to the residents. We need to talk to the doctors. Because even as students, they have become our responsibility now. They've become our loved ones and we need to treat them that way, okay? Because every one of those patients, we should be giving them endless love. That our entirety, everything that we are, when we step into that hospital, needs to be poured out upon them. All of our resources, all of our love, all of our attention needs to be given to each and every one of our patients. And if you're not going to do that, quit studying right now and don't be a doctor. Because we need doctors that love their patients endlessly, that love their patients with all of their heart, with all of their might, with everything that they are. And if we're not doing that, we need to quit. See, these families are putting their trust in us. They're putting their hope in us. And we need to respect that. We have such great responsibility that the lives of people are in our hands every single day. Their hope, something as strong as hope, is put into us. And we need to treat that and respect that with everything we have. So if you haven't got that picture yet, if you don't know the cost yet, if you don't know the sacrifice yet, then put things into perspective and make sure you are going to be willing to give everything you have, all of your heart, all of your love, all of your passion, all of your desire, all of your will, all of your might into each and every one of your patients. And if you're not going to do that, quit studying now and be done. Let us continue in love and let us continue in prayer for our future patients. Their life could depend on it. I love you guys. I'm sorry about the rant, but I want to make sure that we all love our patients with everything that we have.
If I speak with a silver tongue, convince a crowd, but don't have love, I leave a bitter taste with every word I say. So let my life be the proof